Hello, hello, hello. So today we're going to be talking about the ABCs of diabetes management. I know, right? ABCs. Coach Adrienne, I know my ABCs. I know my one, two, threes. I know. I know you do. But for today's topic and for today's session, we're going to be talking about the ABCs of diabetes management. And this is crucial, crucial in your pre-diabetes management. Not only are these the numbers and lab values that you need to know about, it's also the numbers that you need to be aware of to continue to be successful in your pre-diabetes management journey. So let's get started. So ABCs, yes, ABCs. When we think about A, that's for your A1C. Now, you've probably heard of this number so many times. So when you go in to talk to your medical provider and they've drawn labs, typically one of the lab values that they use for the prediabetes diagnosis is your A1C level. Now with your A1C, these numbers usually show your blood sugar levels for the past 3 to 4 months, what your percentage has been, and what your numbers are. So based on your A1C level, this is how you receive the pre-diabetes diagnosis. So let's talk about today 3 tips in managing your ABCs. A1C, B is your blood pressure. For your blood pressure, this is the number that I often tell people, this is the silent killer. Yes, take all of that in. Take all of that in because with your blood pressure, this is a silent killer. A lot of people don't even know they have what we call hypertension, also known as high blood pressure. But with high blood pressure, when your numbers are elevated, my goodness, they can cause so much damage. So much damage. So when we talk about blood pressure, I always tell people, understand what your blood pressure numbers are. If you're diagnosed with hypertension or high blood pressure, are you taking medication? Have you been prescribed medication? Do you understand what medications you're taking? And if you don't, clarify that with your medical provider. Discuss that with your medical provider. Because oftentimes what I find is that I've had clients and patients in the past that have been diagnosed with hypertension or high blood pressure and they don't take the medicine for whatever reason. Now, if it's a cost issue, that's definitely something to discuss with your provider. Let them know if the medication is out of range for your cost and your resources. There may be other options or other alternatives that they can prescribe for you. So do not let that be a barrier. Talk to your medical provider to let them know your cost concerns. But I've also had other clients that can afford the medication, but simply because of something they read or concerns, which I definitely want you to talk to your provider about any concerns, any questions, anything that you may have read that may make you feel uneasy. Talk to your medical provider about that because that's definitely something you want to address with them and to be clear on those instructions. But do not simply not take the medicine because of something you read. If there's a question or a concern, bring it up to your medical provider so they can address those questions with you. And if there's something else that you need to take or another option, they can prescribe that for you instead. But as I mentioned, high blood pressure is a silent killer. So your blood pressure can be elevated. For some people, they may have symptoms. For others, they may not. So I cannot stress this enough. I've been a nurse for over 20 years. I've seen so many cases of people having high blood pressure, either not knowing it because it has not been diagnosed yet, or knowing that they have high blood pressure, but not managing it correctly and have had devastating effects. Well, when I say devastating, I mean I've had patients with have strokes, some with residual effects, what we call residual effects, which means they may have problems with extremities, weakness, like their arms or their leg weakness, speech impairments or speech problems. So I cannot stress enough, and you may hear me talk about this a lot, But I really see and have seen so many devastating effects from high blood pressure that I always want to stress to people: manage your blood pressure. If you have high blood pressure, check your blood pressure so you understand what your numbers are, like what your ranges are. How do your numbers normally look? Are you having stress? Or is something different going on in your life that may be making your numbers higher? So A1C, B, blood pressure, and C, cholesterol. So ABC, A1C, blood pressure, cholesterol. Your cholesterol matters. Your cholesterol matters. Your total cholesterol. You may hear HDL and LDL. We typically call HDL your good cholesterol, your LDL your bad cholesterol. But the most important thing that I tell clients and patients and participants, understand what your numbers are. When you have your lab values drawn, understand what those numbers mean. Are your numbers elevated? Are they within range? Know what these numbers mean. So follow up with your medical provider, and see what ranges they recommend for you, because each lab value has a different range. Total cholesterol, your LDL, your HDL, and with your LDL, the higher those numbers are, that sets you up, unfortunately, for heart risk factors. So for some people, when they have higher LDL numbers, they also may have some associated heart problems or heart risk factors associated with those numbers. So definitely, I always stress to people, A1C, blood pressure, cholesterol. These are your ABCs of diabetes management. There's so many other labs that work in conjunction with diabetes management. You're looking at your kidney numbers. You're looking at your urine numbers. You want to know about your filtration, how well your kidneys are with your urine. So it's so many other numbers that you need to know about. But when we talk about your ABCs of diabetes, A1C, blood pressure, cholesterol, these are the top 3 that we're focusing on for today's video and for today's session. But definitely not the only ones that you need to be concerned about. This is just to open your knowledge up so that you know what you need to look out for and to understand the trends. So in our Take Charge and Balance class, our 12-week class, we talk about all these lab values and many, many more. And we also talk about how important it is for you to know your lab values and understand that, of course, you're number one on this healthcare team, right? You're number one. So you as the client, the patient, participant, these are your numbers. And I definitely want you always to be aware of your numbers. Discuss it with your medical provider. If you have any questions, any concerns, always discuss that with your medical provider, because guess what? Knowledge is power. And that is one of the key things that we talk about in Take Charge and Balance. We always talk about you being number one as the patient, client, and participant, but also being your own healthcare advocate and understanding that it is so important that you understand the knowledge needed to manage your healthcare. Don't forget to like, comment, and share this video. We will have links included for our Take Charge and Balance program. It's a 12-week group session offered virtually via Zoom. It's a community. It's a judgment-free zone. I look forward to seeing you in one of our sessions. And also check out our ebooks, our Prediabetes Power Pack, and also Empowered Moves, where we talk about all of the activities and then also barriers that may be faced on your prediabetes management journey. So check those out as well. Like, comment, subscribe to this channel. I'm so looking forward to your feedback, and let me know how you're doing. Take care, and until next time, I'll talk to you soon.